Dr. Patty Ganz has been a trailblazer in the cancer survivorship movement for the past 4 decades. She is a medical oncologist and professor of medicine at the David Geffen School of Medicine at UCLA and professor of health policy and management in the UCLA Fielding School of Public Health. She has been director of cancer prevention and control research at UCLA's Johnson Comprehensive Cancer Center since 1993, where she focuses on psychosocial and quality of life issues for cancer survivors. Dr. Ganz was one of the original members of the National Coalition for Cancer Survivorship, helping to create the cancer survivorship movement, and she has been at the forefront of the movement ever since.
Patty really was a pioneer in looking at the long-term and late consequences of cancer, so focusing on what happens next, not just cure, but care after cancer, which of course was a big mantra for Ellen herself.
I think for me, was really exciting about working with Patty is the incredible depth of knowledge and empathy that she brings to the study of cancer survivors, because really her goal is, we are here to improve quality and potentially length of life. And she really understands the challenges and problems that cancer survivors are facing, and also the resilience that they bring to that to that experience.
Patty really embodies patient-centered care. She embodies it because first and foremost, she listens. She wants to know where you're coming from, what's been going on, and what's important to her patient, not what she, as a medical oncologist, would say you should be paying attention to. She wants to know what the lived experience is of her patients, and she's always focused on that.
By really listening to her patients and learning their priorities, Dr. Ganz creates a strong partnership and a mutual trust with them, focusing on both their physical and emotional well-being, a model for patient-centered care. That's what drew Lily Yang to her when she was diagnosed with breast cancer in 2016.
After the treatment, there's more than just treating the cancer itself. There's also a lot of, it involves the family, emotional stress. I went through infertility before I was diagnosed with breast cancer. So then I was diagnosed with breast cancer. So I couldn't have, we were having trouble getting a baby. So she shared some of the stories and encouraged me, always asking me about it during our visit, encouraging me along the way. So finally, everything went through smoothly, and we got our baby 2 years ago, that baby boy. So I felt like along the way, she also gave me a lot of encouragement. Her share the story she shared with me, and that really encouraged us that there's hope and we could do it. So for that I'm really grateful.
Travis Schlater-Beckner was diagnosed with bone cancer at 17 and went through aggressive treatment with surgeries and months of chemotherapy, followed by remission. But more than 10 years later, he was struggling with both physical and emotional issues that many cancer survivors experience after their treatment.
I was in my late 20s when I first met her, and to be honest with you, I was in a hard place in my life where I was scared. I didn't know what was going to come next. I guess every doctor that I'd seen I was used to. I've seen a lot of great care providers that, were very kind and very intelligent, but she was the only one that I think married that amazing, supportive manner, the kindness, the warmth, with the honesty I needed. I was probably 28 or 29 when I met her. And I think I made a joke about, I haven't started putting away for retirement yet. And she put her hand on my arm and she said, I'm sorry, I'm getting a little misty. She said, "Oh, sweetie, you're probably going to have to save for retirement. We're going to take good care of you." And she gave me an honest answer. She said, "You know what? as medical science progresses, we're great about catching things early. We're great about monitoring things. So I'm going to work with you. We're going to catch whatever comes up. We're going to monitor it. We're going to treat it, and it's going to be okay.